call the meeting to order at 6 p.m. You guys ready? Can everybody please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, next on the agenda is reading of the mission statement. Linda Bush, can you please read that for us?
Sure. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provide quality services which promote recovery, community participation, self-sufficiency, and independence.
Thanks, Linda. Next is adoption of the agenda. Phil?
Madam Chair, I'd like to make a motion to amend the agenda. Items B, C, and D, I would like to remove voting for final approval. If I have support, I'd like to speak on that too.
Motion to move. Support. Okay, well, did Phil make the motion? Yeah. Okay. So second by Lori? Yeah. Okay.
And then just real quick, the reason for the change is I spoke with Corporation Counsel today, and we cannot do final approvals at program and budget. We can do it either through the executive committee or at full board. So these will be motions to move forward to full board. Thank you, Madam Chair.
Okay. Any further discussion?
I have a question about that.
Is that in time for the clubhouse to be able to still do? Great, thank you.
I spoke with Bruce, and he is all set.
Thanks.
Okay. Any further discussion? All in favor?
Aye.
Any opposed? Okay. Next well, now do we need to adopt the agenda as amended, or do we already do that?
We're good.
Okay. Next is hearing of the public. Is there anybody in the public that would like to speak? Going once, going twice? Okay, well, there will be another hearing of the public at the end of the meeting. We'll move on to request to approve 5A. Can I get a motion?
So moved. Support.
Okay, who spoke first?
It
Okay,
doesn't matter.
motion by Selena, support by Lori. Okay, Dave, is this you?
No. Look, Adam's already just checking out.
Right.
This goes back a little bit. So if you recall, we used to have the Mork homes, and Mork basically had a residential provider network that they organized underneath themselves. We took action to do directly contract with each of those homes. During that process, there was a residential provider in Oakland County who they decided that they would prefer not to contract with us. It creates an administrative issues on the provider to be contracted with multiple counties, PIHPs. So we didn't want to have to relocate the individuals there. We reached out to Oakland County to offer a COFR agreement. COFR is a county of financial responsibility. It's a formal process through the state. It's in the mental health code and all of that. Basically, we decide upon it's a general fund agreement because the Medicaid dollars, the PMPMs from the state would move over to the other county, and then we're looking at general fund to cover the other services. It's gone back and forth. Originally, Oakland County was not open to doing the agreement, which kind of caught us by surprise. But now they are in agreement. So that's what's in the packet is the general fund COFR agreement between us and Oakland County Health Network. And went through legal, it's been approved, and finance has checked it on our side and is in agreement as well.
Okay, thanks, Dave. Any questions or discussion? All in favor?
Aye.
Any opposed? Okay, let's move on to item 5B. So are we not doing request to approve, or requesting to move to full board? Okay. Item 5B, request to move to full board, the Mdhhs fiscal year 2023 allocation for community mental health services program. Can I get a motion?
So moved. Support.
Okay, motion by Linda, support by Selena. Dave, looks like you're up again.
This is our CMHSP contract with the state of Michigan. So again, this is the general fund. Trying to find it in the packet. So it has the total allocation for fiscal year 23, the proposed. I'm sure it'll be have some tweaks in there going forward. And I think they also this is the one that they attached the updated compliance examination guidelines for next fiscal year as well. I have shared those with Stacy Coleman, who's our Chief Quality Compliance and Privacy Officer. So I think we're all set along those lines. Oh, and I will be reaching out to the state. They did ask for this to be signed prior to the full board. I'll ask for an extension. I'll do that tomorrow morning and let you know if there's any problems with that.
Okay, thanks, Dave. Any questions or discussion? Okay, all in favor?
Aye.
Any opposed? Okay, let's move on to item 5C, request to move to full board, conference attendance out of state, Clubhouse International World to employees. Bruce, you ready to talk about that?
So moved.
Oh, can I get a motion? Linda?
Support.
Again.
Thank you, Linda. Support by Phil.
Yep.
Bruce.
Thank you, I appreciate it. Every other year, on even years, Clubhouse International does a world seminar. On the opposite years, they do a USA seminar. This being 2022, and Clubhouse International is doing their world seminar that's taking place in Baltimore, Maryland, on the 17th of September through the 22nd of September. There are a number of positives to attending. One, and most importantly, it's an opportunity to do a lot of networking and have conversations with other clubhouses, not necessarily from the United States, but around the world, and bringing back some of that information that they do in their own clubhouses to strengthen our own clubhouse. Secondarily to that, it allows us an opportunity to actually present on the world stage some of the good things that Crossroads Clubhouse does right here in the United States, specifically Michigan. So there's great opportunities for us to go. There is a grant that has been approved by the Michigan Department of Health and Human Services for $1,000 per person that is in attendance to the clubhouse or to the Clubhouse International World Seminar. That means that we get $2,000 off the total cost. Our cost really is going to be travel there and back and dinners. Dinners are not included in the actual seminar for the first 4 nights. I also want to say on the record that the Michigan Department of Health and Human Services has also said that if they do not use all of those grant dollars that they've already earmarked for the 40 clubhouses that are being offered to go to the World Seminar, that those leftover dollars may be redirected so that additional individuals from a clubhouse that is already signed up for the seminar can have additional people go. So it's very likely, it's possible that we may have another couple $1,000 for at least 2 more individuals to go. So it's 2 for sure, and it could be as many as 4 of us going to the World Seminar. It's just a great opportunity to do a lot of networking and come back and strengthen our clubhouse.
Okay, thanks, Bruce.
Thank you.
Any questions or discussion? All in favor?
Aye.
Any opposed? Okay.
Thank you.
Moving on to item 5D, request to move to full board, approval of the Mdhhs Amendment Number 3, Community Service Mental Health Services Program 2022.
So moved. Support?
Moved by Linda, support by Antoinette. Dave?
This is simply a budget amendment to our current CMHSP contract with the department. They do reference in there as well the updated compliance information. I believe, to correct my other comments too, the 2023 contract has a lengthy list of the referral documents that are part of our CMHSP contract. Some of them have not been updated since 2014, 2012, things like that. I did print all of those off. I made them print them electronically to a PDF, and we'll make those available hopefully on our website as well. They cover a number of specific topics, which will be very helpful as resources for our staff and for the public as well. But this one was the compliance specifically was updated.
Okay, thank you. Any questions or discussion? All in favor?
Aye.
Any opposed? Okay. Item 5F, request to, oh, did I miss E? Yeah, for some reason I thought we did that one, sorry. Okay, 5E. Request to move items to CMH full board for final approval, MRS Macomb County ICTA agreements. Dave, you have all kinds of talking to do tonight.
I'll make the motion to move that to full.
Support.
Thanks, Phil. Support, was that Lori?
I wrote the board action for this, and I said these were longstanding agreements between us and Michigan Rehabilitation Services, which is the state of Michigan. And then if you go to the body of the agreement, Crystal James actually included these are, I think, 20 plus years in existence. So it's an annual process. The interagency cash transfer agreement pretty much allows us to contribute general fund dollars to the state of Michigan, and then they magically are able to triple the dollars. So if you look at the first agreement, I think the total amount is close to $500,000, but our portion is about $134,000. So it's a really good arrangement. If we had more contracts like this, it would be even better. But it allows them to really work with our folks, help our folks find and maintain the employment opportunities. And this is an area of focus. The employment, it's important. I've jokingly said, I don't know why everybody's not fully employed at this point when you can just drive down Hall Road and help wanted, help wanted, help wanted. But it is a little bit more involved than that. And MRS has been and continues to be very good partners with us in this area. Utilization has dipped during the pandemic, so we're trying to, revitalize it and keep it going forward.
Okay. Any questions or discussion? All in favor?
Aye.
Any opposed? Okay. Now we're going to move on to item 5F. Request to move item CMH full board for final approval, Lands End vouchers for MC, CMH staff, and board members.
Move to approve.
Thank you, Linda.
Support.
Motion by Linda, support by Lori. I didn't see Kathleen, she's obviously here. I can't see her.
I've talked enough.
Hi, everyone. Nice to see you again. I haven't seen you in a
Hi,
while.
Kathleen.
This is not the first time that the board has supported this type of an effort, and I think it's even more important now. Is it not? Sorry, okay. I wasn't loud enough? All right. This isn't the first time that the board has supported such an effort, and I think, on the heels of our brand awareness campaign and the fact that we've had a new influx of staff and board, some great new additions, and the fact that we're getting out there more in the community, quite frankly, we really need people to have more apparel that has our branding on it. And before we were just doing the logo, but I hope it came through. We have that nice type treatment that we did on the bags for people who might be in a position where they don't want to necessarily go around saying they're with community mental health. So it has our nice acronym, but we also have the type treatment. So we have 3 different options that people can wear. And we will this time limit those choices to apparel so that we are supporting people having a nice unified look when they're going out in the community representing us. We don't need any more totes. The board took care of us with those nice laptop bags. Thank you very much. So any questions?
Just through the chair too. When we did this last time, the vouchers went out via email, and we've been doing such a good job with these phishing alerts. We have a program that tries to send us fake emails and keep us all on our toes about, ooh, I'm not clicking on that because that doesn't look right. So when the vouchers went through the first time, a number of our staff reported them as phishing alerts. So they were underutilized the first round, and we will try to correct that this round as well. So it was not fully used the first time as well. I just wanted to point that out, that this, thank you.
I will be staying on top of that, I promise.
Okay, thank you. Any questions or discussion? All in favor?
Aye.
Any opposed? Okay, item 5G, request to move to CMH full board for final approval, DFA 235001 with Mdhhs to retain Mdhhs eligibility specialist in finance and budget. I'll take a motion.
So moved. Support.
Moved by Selena, support by Linda. Dave?
I think the title says it all.
It really does.
For years now, we do have a staff person from the Michigan Department of Health and Human Services who's assigned to our offices. She does a great job in helping people get their Medicaid eligibility, get on Medicaid and keep it. If you've ever tried to navigate that system, it can be difficult sometimes, and there can be specific issues and things. By having her available directly to us, we're actually maximizing our Medicaid reimbursement. So it is definitely a benefit to the people we serve, and actually to our bottom line as well. So it's a win-win. This is a renewal of a standing contract for another year.
Okay. Linda?
I was on the board, I think, when this idea was first proposed. We had a backlog of like months, years. Some people took up to a year to get on Medicaid to receive our services. So this was a great idea, and I totally support continuing the contract. And they've become part of the culture, the family of mental health. So.
Okay, any other discussion? All in favor?
Aye.
Any opposed? Okay, moving on to item 5H, request to move to CMH full board for final approval, amendment to substance use performance-based contracts. I'll take a motion.
So moved.
Support.
Who moved? I missed it. Okay, Ed moved. Thanks. Moved by Antoinette, support by Phil. Dave, you're up again.
Covering for Helen here, but basically Helen Klinger, our substance use director, in communication with our finance department, was recommending some contract language changes to our substance use contracts, to the boilerplate for those. It indicates here it would remove language related to a subrecipient performance-based contracting and replace it with language to reflect a contract-provider relationship. It will better align us with reporting requirements for the specialty grants, reduce some monitoring requirements, and align the administrative cap amounts to be in line with the fee-for-service contract language agreements. So we're looking for this to be in place for our substance use contract boilerplate languages starting October 1st for next fiscal year.
Any questions or discussion? All in favor?
Aye.
Any opposed? Okay, moving on to item 6, receive and file. I don't believe we have any items. Item 7, resolutions. I don't believe we have any resolutions. Other possible agenda items. 8A, CEO update.
Other possible agenda item. That's me. A quick note, I did talk to Richard Carpenter just before this meeting. Neither him nor Ken will be available at the full board meeting for the CFO report, but he will be submitting a written report with some bullets showing the highlights and stuff for that. At things that he would have covered verbally. It'll be a written submission for that. Outside of that, the Board of Commissioners, I think I mentioned last time, did approve us having our own representative at Corporation Counsel. That position was posted, and I will be interviewing those applicants along with John Shapka, Corporation Counsel for Macomb County. I collected some points to cover from Stacy, whose compliance and privacy will be interacting with that position, as I did from Tracy Smith, who's our Chief of Staff, some of the personnel issues and the leases, things like that, touch on that will be part of what that position is responsible for. So I'm prepping for those upcoming interviews. I did want to mention to the board as well, been meeting with the office of Vicki from the county, along with Andrew from the health department, Barb Caskey from Community Corrections, Ernest from Macomb Community Action, Helen, our substance use director, about the opioid settlement dollars coming in to the county. Part of that touches on jail diversion, which, if you recall, we issued an RFP in that area. So there's activity going on, and we are actively following up with Team Wellness, who was the winning respondent to that. But it's morphing now into a crisis stabilization unit. They're statewide. This is a focus. There's earmarked dollars in the current budget. So I'll be keeping the state informed, working closely with the county. The Engagement Center, which the board approved a consultant for us in that area. I keep describing it as kind of a hub and spokes model. So the hub would be the crisis stabilization unit. One of the spokes would be the Engagement Center on the substance use side. Another one would be our adult crisis residential, the children's crisis residential, urgent respite for children, perhaps. So we're looking at building that crisis continuum even better. Of course, reaching out to our health system partners as well. I did meet with Henry Ford Hospital this week. The are folks that are getting, are staying in the emergency rooms for too long, and that's putting it way nicer than it actually is. The impact on these people is upsetting. The state in its meetings now, Dr. Mdhhs is the director of the State Hospital Administration. They're taking 110 beds offline in the state hospital because of staff shortages primarily. And at the same time, he made the distinction very clear that state hospital is a general fund service specific to people with severe mental illness. And the ICF, it's an intermediate care facility for people with intellectual and developmental disabilities, or an ICF IDD, if you like to throw around the alphabet soup. Those don't exist in Michigan anymore since they closed the Mount Pleasant Center. So really now there's no place for a person with a developmental disability to access a state hospital level of care unless they happen to have a comorbid mental illness that would qualify them for that stay. That puts us in even more of a rock and a hard place situation. And Henry Ford has people right now there who are waiting for community options to be presented to them. Of course, those are limited. We're actively working to identify and expand our residential network as much as possible while working at the state level. This crisis continuum stuff, crisis stabilization unit that I mentioned, would over time reduce the number of people who are even presenting in the emergency rooms, which of course would be the ideal if we can prevent them, redirect them before they ever go there, and then have those options within our community-based system. But right now it's creating a real issue. No quick answers, but we came up with some creative things, and I should have some more updates at our next meeting. I was actually following up with a text related to that problem right now. So we are very open to ideas, getting as creative as we can be, and I'll continue to provide updates along those lines. But the staffing crisis continues to be the number one most pressing issue. I know our providers are thankful for a memo was going out. It was finalized in our finance meeting this afternoon. That's going out to both our substance use and our behavioral health providers to clarify the various rate changes and financial stability things that are available to them, and their status going into next fiscal year. Because everybody's in budget season right now. It'll help their stability, it's hoped, with us giving them as much advance notice as possible. So that's going out. The provider stability payments will continue during the public health emergency. We are continuing to be open to creative ideas on the program and service side. The rate changes that the board put in place will continue, and the community living support and respite rates are slated to continue all the way through the end of next fiscal year. And then we did meet our meeting with the fiscal intermediaries. We realized, not too late, when we changed the CLS rates and the respite rates, it wasn't clear how that would impact people who were self-directing those services. So we had to do a little regroup internal. We got that message clear, and we're meeting with the fiscal intermediaries to update the budgets for those individuals and get those in place as well. So lesson learned, when we do some of these rate changes now, I have to take those folks into special consideration. But a big thanks to the staff working in that area. It was a lot of work, but we pulled it together quickly and have a good plan going forward. So I'll conclude on that note. Thank you.
Okay, thanks, Dave. Item 8B, reminder, CMH full board meeting Wednesday, August 24th at 6 p.m. And then we're on to item 9, hearing of the public. Anyone in the public wishing to speak? Going once, going twice? Okay. I'm going to close hearing of the public, and I'll take a motion to adjourn. Moved by Nick, support by Antoinette. We are adjourned. Thanks, everybody.